Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the clinical features of diaphragmatic injuries? So, diaphragmatic injuries, if we see the clinical features of diaphragmatic injuries, actually, most of the diaphragmatic injuries are silent. Most of the diaphragmatic injuries are actually silent, and actually, in the diaphragmatic injuries, the diaphragmatic injuries per se do not cause any symptoms. Whenever there is injury to the surrounding organs, that is when we have to suspect the diaphragmatic injury, because most of the cases it is silent. So the late complication are because of the injury to the diaphragm. Whenever there is injury to the diaphragm, the stomach which is present in the abdomen or liver or spleen or kidney, adrenals, or any organ which is present in the abdomen can herniate, reaching the thorax and compressing the lungs and thoracic structures. So the late complication of diaphragmatic injury is herniation of abdominal contents into the chest. Okay, what is the first organ to get herniated from the abdomen into the chest? So herniation of the organs will follow the following order. So most common organ to herniate is the stomach, followed by colon, then small intestine, then omentum, followed by spleen, kidney, and pancreas are the organs which will herniate into the uh, the thorax. So herniation of organs is first and foremost herniated is stomach, followed by colon, then small intestine, omentum, spleen, kidney, and pancreas are herniated.
thank you and thank you for watching.